Surprise, surprise. We got paid a couple $100,000. Never do I get from any of these people, you know, the project costs less. We're gonna give you back some money.
There was one credit in there. Did you see
I
that?
saw
That's
that,
part of
but
it, yeah.
overall,
I know.
not lately, no.
I got one kind of recently.
A month ago I got one.
Or to be right. I got my first one last week.
We're going to start.
Yeah.
Nobody calls me.
I got it from.
Good morning. We're going to convene the Scott County Board for February 17th. If you'd rise for the pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Item 2 is amendments to the agenda. I don't believe we have any. So we'll move to item 3. Item 3 is to approve the minutes of February 3rd, 2026. Do we have a motion to approve the minutes?
Second.
We have a motion and a second. Any discussion? All those in favor say aye.
Aye.
Opposed? Motion carries. Item 4 is recognition of interested citizens. This is limited to items that are not on the agenda, and usually it's 5 minutes per person per subject. And if we have speakers, we'd ask you to come to the microphone and we'll proceed from there. Do we have anybody? All right, seeing none. Consent agenda generally passes as one motion. I'll read the consent agenda. 5.1 is to adopt resolution 2026-22, authorizing entering an agreement with Urban Edge Solutions and Supply LLC for the County Highway 23 and 68 roundabout project. 5.2 is adopt resolution 2026-35, authorizing entering into amendment to the agreement with Waste Management of Minnesota, Inc. 5.3 is to adopt resolution 2026-37, authorizing a budget amendment and contract increase for the SM Henches and Sons, Inc. work on Trunk Highway 169 and Highway 59 interchange project. 5.4 is to adopt resolution number 2026-41, amending the capital improvement budget and approving the purchase and installation of audiovisual equipment at the Belle Plaine Library. 5.5 is adopt resolution 2026-42, authorizing submittal of a 2026 build application for the Highway 13 project. 5.6 is adopt resolution 2026-44, authorizing a budget amendment and authorizing entering into an agreement with Access Network, Inc. for fiber audit services. 5.7 is adopt resolution number 2026-45, authorizing a budget amendment and entering an agreement with Hartman Well Drilling for the central shop well replacement. 5.8 is adopt resolution number 2026-47, approving a 3-year agreement with Health and Human Services Supervisors Association. 5.9 is approve appointment and reappointment of citizens to advisory committees. 5.10 is approve payroll processing of personnel actions. 5.11 is approve record of disbursements and approve claims. That's our consent agenda. Do we have a motion to approve the consent agenda?
I'll move it.
Second.
Any discussion? All those in favor say aye.
Aye.
Opposed, motion carries. Item 6.1 is to receive information on Scott County Delivers topic, disability services.
Like a thunderstorm.
All right, well,
Go ahead.
thank you, Mr. Chair. Today's topic is disability services, specifically Minnesota's long-term services and support system. These services are critically important to ensuring that people receive necessary support and case management. I would like to make a special thank you to our case management partners that are here with us today. We have Allison and Elizabeth, so thank you for taking the time to be here. First, I would like our question askers to introduce themselves, and then I'll have the panelists also introduce yourselves and tell us where you're from. I'll start. I'm Katie Malika with Quality Improvement with Scott County.
Brad Davis, Director of Physical Development.
Nate Thomas, Transportation Design. Lisa Kohner, Office of Public Affairs.
Melissa Hurt, Children and Adult Disability Services.
Megan Westberg, Adult Protection and Waiver Case Management.
Katie Clavercamp, Min Choices.
Autumn Carlson, Min Choices.
Allison Sylvia Cochran, I'm with Pinnacle Services.
Elizabeth Hall, I'm with Mount Olivet Rolling Acres.
Brittany Lane, Aging and Disability Services.
Brittany, is there anything from the start that would help frame the conversation for us today? Just a one-sentence overview? Okay.
Sure. I mean, what we're talking about today is just disability services. There's a lot going on in this area within the state of Minnesota. So we're hoping to talk about what the current state is, as well as some things we're looking forward to in the future.
Perfect, thank you. Commissioners, as always, you're welcome to pop in and ask questions, but do you have any foundational questions that might help frame the conversation for you?
I do. I receive a newsletter from the Down Syndrome Association of Minnesota. In a recent letter, they point out that individuals and families are having payments stopped or paused for personal care assistance. In a follow-up conversation, this accounts for services to 8 BIPOC individuals living outside of Scott County. Those folks were on the Community First Services and Supports. There's a concern that these actions will continue and will impact availability of programs accepting new clients. So what is Scott County, how is this affecting Scott County, and what is being done to mitigate that?
I can speak a little bit to that. And so we are notified by DHS when a provider actually loses their license. So far, we've only been notified that there have been 5 providers that have been asked not to provide services ongoing. I think that affects 14 or 15 clients. But beyond that, we're hearing a lot of chatter from providers. The review process for payment is delaying the payments that the providers are receiving, and then therefore they're having difficulty paying their staff. That's not something that we're tracking real formally at this point, but we are connecting with case managers, trying to get ahead of the game just to make sure that we're communicating with providers, that we're doing our best to support the people that are receiving services. Beyond just kind of like advocacy and trying to stay ahead of it as much as possible, I don't know if there's a whole lot we personally can do besides the advocacy piece.
I think I'll just add on
Yeah.
to what you're describing is the prepayment process that DHS put into place in October. This is as a result of wanting more program integrity and more oversight of the services and what's being billed. So we don't have a direct impact or a direct role in this, but payments are being withheld as they're being reviewed. What we're hearing is that as this initial delay, once we move through that, providers, there won't be quite as much of a lag as there was with this initial wave.
Thank you. Okay, Lisa, if you'd like to start.
Sure, thank you. Hello. I just have a quick question for my own edification, and I hope that this isn't just remedial. And I know we're supposed to be focusing on outcomes, but I just need a little bit of information here. The whole idea of min choices for initial assessment, 20 days, has come up repeatedly. And I know that our own HHS director has testified before the legislature about some of the problems that we have with reassessments and things like that. But going through this material, especially not only in the narrative, but on pages 14, 15, and 16, but particularly on 15, it references the 10 to 12 hours, I believe, of initial assessment hours. Is that correct? Yeah. I was just wondering if somebody could give me a sense of what that entails, because that's a big chunk of time, especially when it has to be done individually.
Yeah, I can speak to that. So it's kind of a two-part process. So the first part would be going out to the person's home and doing the assessment with them in person. So for initial assessments, that being their first assessment they've ever had, it usually can take about anywhere from 2 to 3 hours on average. Sometimes it can be up to 4 hours just for that assessment piece. So going through all of the questions can take quite some time when we're in their home. And then the second part would be coming back then and working on the paperwork. So going through, those questions, making sure everything is written well and person-centered. And then we would actually be working with the individual also to do things like get set up with medical assistance or certified disabled through the state medical review team. So there's lots of moving parts and things that we work on, both with the person in their home and outside of their home.
I have a follow-up question to that, if I might. That obviously seems like it entails a lot of training on behalf of the assessor. How long, in your estimation, in your professional experience, does it take to get somebody fully trained to be able to do these assessments?
That's a great question. So with Min Choices revision, what we have seen is if someone is coming in that has case management experience or county experience, we typically see about 3 months. When someone does not have that background, we are seeing it take up to 6 months to get someone fully certified and doing assessments at the capacity.
Thank you.
I'll stay on page 15 here, looking at this chart, kind of comparing the initial assessments to the reassessments. Is it common to see a need for change in those reassessments when they're done annually like this, or is that too long, too short in your opinion?
Yeah. I would say that's a tough question, to be honest. Sometimes, yes, there is a change. We see more changes with kiddos because year to year they grow in independence, or depending on what their diagnoses are or what type of support they need. We may see more changes with kiddos that a yearly assessment is more appropriate, or elderly, because at that time they may have other health changes that affect or limit abilities. But that in-between age oftentimes is where we see less of a change. So I know we have talked about that having a certain age, like after 21, before age 65, that there could potentially be a benefit of not doing an annual reassessment. And I know a couple years ago we did a survey with Scott County clients that have utilized services, and that was some of the feedback that we had received as well.
This is one of Scott County's legislative priorities this year, looking at the frequency of reassessments. And to Katie's point, that in-between age, these are folks who, they have a chronic condition. It's not acute. These are long-term needs. We anticipate they're not going to change significantly from year to year, and therefore our priority this year is to see a reduction in the frequency of how often we're doing those reassessments, because of the amount of time that they take, as you were asking about, Lisa.
As a follow-up to that, is there any capability within the system to designate people differently? Like if someone does have a long-term condition that generally doesn't change?
That's a great question, Katie. System modernization is something we talk about a lot. I suspect the technology is there somewhere, though I don't know that that is something we have access to right now. And we're talking about state systems, so it's not something that Scott County can tweak and make those kinds of changes.
I have a couple of questions on referrals to completed assessment. Page 14 tracks just the timeline, and it was mentioned earlier, there's this target of 20 business days to complete that assessment. And I'm just curious, first, where does that 20-day timeline come from, if you know any history of that? And then, is that the right target from your professional judgment? Is that a reasonable target?
I would say no, it's not a reasonable target. The history, I'm not quite sure, but that is directly from DHS, through statute. So, right now, we have about a 4-month wait list, so we're not meeting that 20 days. I know, we worked really hard on decreasing our wait list over the last year or so. But yes, it's not very reasonable just with kind of how the flow of things work and, you know, having a wait list. You know, we've seen that from the initial assessments we've done in years past, a certain percentage of those turn into reassessments the following year. So there's kind of always this ebb and flow, and the work that we do to reduce wait lists can then turn into needing more reassessments the next year. So then that we're having to dedicate more staff to doing those reassessments. So it's a little bit of a tricky balance.
And I'd also add that this isn't solely like a challenge for Scott County. This is across the state. So that 20-day timeline, we know our neighboring counties also have wait lists, so they're also not meeting that statute requirement. So just to highlight that.
You just leapfrogged right over my next question then. I was gonna ask, do we know how many counties actually meet the standard right now? We don't know, or just nobody?
I guess I don't know that
Okay.
answer. My thought is like our more northern or southern counties that aren't as large.
Yeah, yeah.
They may not have as big of a challenge, but I don't know the answer. So
I know the counties that we work with at Mora, Dakota, Hennepin, Washington, McLeod, like they all have, that nobody's meeting it in the Twin Cities that Mora works with at least.
Sure, sure.
I would say Scott's is probably on the shorter side than some of the other counties.
Oh my
Much
goodness.
shorter.
Is that 20-day timeline only in Minnesota statute, or is it derived somehow from a federal requirement?
That's a good question. I don't know the answer to that.
Okay. Well, it looks like at least there was a good shift in terms of calendar days versus business days, so that's hopefully helpful to you. Thank you.
I have a question, if I might. Is there any mechanism, okay, if it's 80 days average for an assessment and somebody really needs services, is there any mechanism where they could get the services and be reimbursed to the provider or reimbursed? In other words, is there anything prior to the approved assessment eligible to receive any funding for that?
I'm not aware of that. I mean, I guess I can speak through like the adult protection lens. I mean, if something escalates to the point where somebody's health and safety is in danger because they're going without services, then sometimes they'll come through adult protection if we'd screen them in. We have an internal process to prioritize some of that, you know, cut out the wait list a little bit and get people help, but that's the only way that I'm aware of that we would be able to expedite something
So
like
you're
that.
able to speed up the process in an emergency?
Yes,
Okay.
correct.
There's certain criteria that would meet our expedited assessment, which I believe, are they taking 8 days right now for an expedited assessment?
For a hospital, we have to do it within 15, I believe. So I think it's 8 or 9 days on average for somebody discharging from a hospital. And there are a few other things on that priority criteria list that we would consider moving people up on the wait list. But yeah.
Mr. Chair, just, I think Brittany could give a little more information towards that question. With some folks, especially folks who need nursing level of care in nursing homes, sometimes they do get admitted before this process happens, and there's retroactive to once the medical assistance is approved, which ends up being tied with this. And that's one of the changes on the federal level, that used to be retroactive for up to 3 months. right? And now the federal legislation is making that only 2 months. So with this kind of wait, that's why so many of our nursing homes and senior care facilities are concerned.
Thank you. Well, this is complicated. I hope that you'll, like, as we're giving you answers, that you can hear the undercurrent. You change any one thing and it's very complicated. It impacts a bunch of others. So if I understood your question correctly, would there be back payment or retroactive? In the state of Minnesota, you need both medical assistance eligibility and have had that MnChoices assessment completed. We would not be able to pay for any of the home care services or waiver funding would not be, we would not be able to access it unless both of those two things are in place. So if we are 4 months out on doing an assessment, we would not be able to backdate prior to the MnChoices assessment to access funding.
I have a question on page 13. So the chart there shows the increase in case management cases that have been contracted. How has this partnership helped the county with the increasing demand?
Are you talking about partnership with contracted case management agencies?
Yes, yep.
Sure. Anybody want to answer that one?
I could speak to that a little bit. I think increasing our partnership with contracted agencies is paramount to us just meeting the need. We don't have large enough teams internally to assign all cases to internal case managers, so we heavily rely on our contracted partners. We're very grateful for them. They work really hard, and we work closely with them. If they have any crisis issues come up or complicated system technical errors, we're right there alongside them, problem solving, to make sure that it's resolved, whatever it is.
Well, and to that point, I think the reliance on contracted has grown, which is what this slide is showing. Even if we look back to 2017, we had a few cases that were being served by contracted case management, but the majority at this point, the majority of our cases are served by contracted case management. We have, you've heard a lot about MnChoices already. We've spoken about MnChoices in the past. Like, we've shifted our internal case management staff to meet the need in MnChoices, and as a result, we're relying more heavily on our contracted partners.
A couple of questions for the contracted vendors, Allison and Elizabeth. What are the metrics that you use in your business to kind of check performance? Are they the same measures that we've been looking at the county?
I would say for us, yes, there are guidelines as to like when DHS does an audit of what should be followed. So like at Mora, we do support plan audits. We have like timeline checks. We have a lot of tools in place. We have like this quick audit, which is like a snapshot of like how soon you met with the client, how soon you made contact with them, when you completed that support plan and got it out. How well like you did on that support plan. So we have a lot of internal things like that in place to keep that quality. And then Scott County has their own guidelines of what we should be doing, like review any service agreements that are asking for an increase in services. And then Scott County looks at certain service agreements that are like for the more expensive services, like night supervision and things like that. So there's a lot of quality checks in place, both for us internally and with the county as well.
Yep, at Pinnacle, we do a lot of the same things. We do, as captains, we are checking in on cases, like maybe once a month for established case managers, just checking for those quick audits, like are we meeting timelines? And then we have a training team that trains our new hires. They do, I think they're 2 audits a year for our full contract, and Pinnacle has a pretty extensive form that we use to audit not just the support plans, but client files as well.
As these numbers are increasing, what are you watching moving forward?
For us, like it's kind of working really closely with the county. Like we just started our contract with Scott County in January of 25, and there were like 2 case managers and a supervisor when we started, and now we're up to a team of 6 case managers. We have like 210 clients, which has been really exciting. We've really enjoyed working with Scott County and we want to grow that contract. So Maura is willing to hire. But like when we did hire based on the number of cases that we were getting. But then that slowed down over Thanksgiving and Christmas. So we had to shift that staff to a different county internally. And that's really tough because we are like moving, ready to grow. But then when things slow down internally with those MnChoice assessments, it affects our plans. So it's hard to always plan without, like a specific timeline, but just kind of being flexible and working, I beg for cases a lot, sorry, Melissa, but just kind of being open to that flexibility and just, for us, we really want to grow the Scott County contract and figuring out like what we can do to support the needs to make that happen.
Yeah, sorry, can you repeat it one more time?
Oh, just like what are you watching going forward? So it could be not only caseload side, but just as like today the legislative session starts and as changes happen too, like what kind of things are you keeping in mind?
Yeah, I think our team at Pinnacle, some of the things that we are keeping in mind is some of that stop payment with Optum, like that third-party payment system. We've been keeping an eye on that CFSS, that Community First Services and Supports, and kind of how that transition is going, because it has been a struggle for both case managers and clients to fully transition. I think that's what our team is kind of focusing on right now.
Those pieces are really challenging too. Like the whole CFSS rollout happened, and I mean, I think initially there were maybe 23 consultation agencies in the state, and there just aren't enough. And like you used to be able to get PCA services right away as soon as you got that assessment and you opened your case, and now like you have to have this consultation piece, and if there's not enough consultation providers, you can't get that consultation, which means you can't start that service, and that's really frustrating. And a lot of clients don't understand all the specific services. They just know that they're getting someone to help. So we can be like, we can give you this service, but we can't give you the service until you do this thing. And it's really confusing. And a lot of times waiver services are confusing to start with. And now we've added in this extra layer of like, does it make sense to the clients especially? And it's been really challenging. The whole stop payment thing, like a lot of times staffing shortages are really tough with providers. And now we have providers. We have a client currently who's 70 and lives in his own home, and he's had the same staff with a very small provider for over 20 years, and that provider can no longer like front the money to pay her staff, and he is at risk of losing. And I mean, everything in his life works because he's had this consistent staff, and those stories are really, really hard. And there's definite oversight that's needed, but for the people who are using the services the way they're intended, it's really, really tough to figure out how to help those people.
I've got another question if I could. I'm just curious, contracted case management versus non-contracted, what's the cost difference between, I know in other areas of healthcare, in long-term care, when they have to contract out, the staff cost is a lot higher than internal staff. So what's the cost implication here?
There's no difference in cost. So
Okay.
if you recall, a few years ago, the billing went through Scott County, so we would reimburse the contracted case management agencies. That ended in 2025. So contracted agencies are billing directly to DHS, just like Scott County is. So everyone is receiving the same reimbursement.
Okay, great.
I have just a quick question about, it's also throughout the narrative, but specific to page 27 of the state's presentation. It looks like the proportion of those younger than 25 and younger are increasing faster than, it's more disproportionate to the population growth. Is there anything that you can attribute to, or what kind of factors are in play here that's contributing to that growth? Is it just better identification, diagnosis? Was there a triggering, like has COVID had an impact on like child mental health? I don't want to answer for you, so I'm going to stop there.
I think you highlighted several very relevant factors. Absolutely, we have better access to testing, so we are seeing more children getting diagnosed. I do think there is still some trickle down from COVID where we didn't have eyes on children They weren't in school, so they aren't getting those other professionals who are also observing and then making recommendations. There was also a change last year with medical assistance for TEFRA. There's no longer a fee if a child is certified being disabled. So there used to be a sliding scale on that. And so if a family had private insurance, they would just tap into that. They wouldn't necessarily come this route because it was going to cost them more. That is no longer a barrier for families, which is positive, but it also increases the volume. Those are the factors that I think I noticed the most. Contracted partners, I don't know if you feel like you see a trend with that too, or you get a lot of our new kiddo cases.
I feel like for us, a lot of times, I feel like the special needs community can be a very tight group of parents. There's a lot of groups, a lot of friendships that are formed there. And sometimes you don't know what you don't know until you find out things and they're like, oh, I can get help, you know. And I think there's talk and chatter within the community. And when people understand and realize that there is a way to get help with things, and they start to like try to get those same services. So I think word of mouth would contribute some, and then for sure like diagnoses and just kind of more acceptance with disabilities these days. It's like it's not as taboo to be certified disabled because it's just about getting a level playing field for kiddos.
Quick follow-up to that, if I might, if that's okay. I'm assuming from what I heard here, with the exception of COVID, and God forbid we have to go through another pandemic, but these seem like they're going to be pervasive going forward. This is not an anomaly that you're just going to see an increase in this the younger population. Has DHS or anybody done embedded that in their modeling in terms of anticipating future needs?
I think you're picking on the thread of what we're currently trying to figure out. The work groups that we have with the state, with DHS, that's exactly what we're trying to determine. This slide, this is a DHS slide, and it's included because I think DHS is also presenting this as they're trying to understand where are all of these changes coming from, what's the root. So there are a lot of things that we are discussing as potential changes to stop what really is unsustainable growth. The language that's been used throughout the narrative is unsustainable. Right now, it's an unsustainable system. The growth is not sustainable. So we're really working hard in current day with DHS to look at what can we do to bend that curve. And so we're looking at all kinds of things from eligibility at the very beginning to just the different services that are available and the cost of them, and putting a cap on some of those costs. So we're early in. I say early, our timeline is very short for coming up with solutions that are going to be presented to the legislative session, but we're actively working on coming up with some ideas that both DHS and counties can agree on moving forward to try to stop the curve, or growth, I should say.
Page 17 shows a chart, the percent of support plans mailed within 60 days. And I think I had read earlier on in this report that Scott County was at 100% in December of 2025. So what has helped improve that performance internally to reach that 100%?
I think we've just been trying to keep a really close eye on it. I know as a supervisor, that's something that regularly is discussed during our one-to-one meetings with case managers, just to make sure that we're highlighting that date when we're assigning cases. And I just think we're having a lot of conversation about that. That's an important measure that we need to be meeting. So beyond that, I don't know if there's anything that we can attribute to just discussion and kind of eyes-on training.
Can you tell me a little bit more about what are in those support plans? And then I was just curious on the delivery of those plans, why they're not done in person versus mailing them to the clients.
Support plans are created after a case and I'll speak from the case management side because they're also done with MnChoices, but on the case management side, the case manager goes out to meet the person, talks about their goals, talks about their services, captures all that information, then comes back to the office and types that all up in a support plan and identifies what services they're going to be using to meet those goals, what their needs are, what their preferences are, things like that. So it does take time to come back to the office and do that. And then those are mailed out so the person has a copy of exactly what their plan is and what they're working on in the upcoming year.
Yeah, they're very detailed, they're very extensive, they take a long time. It has, you know, provider name, all their state identifier numbers, the rate of service, how many units, what's the time frame, and there's all this person-centered language that the state requires that we put in there. It's pages of information, just narrative. A lot of it is redundant, what's captured in the assessment. I think that's something that we've talked about too, like, is this the most efficient documentation approach to the whole service plan? So it's time intensive.
Page 18 had probably some of the most interesting data that I thought was in the packet, and it's how the clients are rating
Yeah.
your services, both county provided and contract provided. And so I probably have a couple of questions in this graph, but for the county staff, how does the survey feedback for the contracted organizations, which we have 2 of them here, how does that feedback then influence some of your decision-making and how you manage the contract with these vendors?
It's a great question, Brad. You know, up until now, we've been relying on our contracted partners because we have to. We don't have the internal capacity to manage workflow. Some of this is still fairly new. Like Mora, we just onboarded. It's been a little over a year, and so we're still, I think, looking at what data we're getting, what that does tell us, and then trying to figure out what do we do with that. There has not been any overarching approach to, okay, annually we're getting the survey information and then doing something very formal with the survey data. I think more of that is happening in day-to-day time. We have staff that are dedicated to supporting contracted case management. We have active clients who they'll let us know if they're unhappy, and we're dealing with that in real time. So I would say we're handling it more that way than any formal process as of right now.
Do you have certain clients that ask to change from either contracted to non-contracted, or?
Yes, I'll let you guys know.
Yes, we do. We do. And it can be both ways. Sometimes, like, I don't want a Scott County case manager. I want to work with a contracted partner. They feel like a little bit 1 degree moved away from the county for whatever reason, maybe some historical interactions they prefer not to. And then we also have cases that, you know, families that would prefer to come back and work internally with the case manager, or they don't feel that they're getting the support they need through contracted partners. Turnover is an issue, and we tend to see more turnover with staffing at contracted partners. They do have wonderful, long-standing staff as well, but part of, you know, growing their teams, like they shared, you're going to have new case managers, and so sometimes it's just not a good fit or it gets bumpy, but we always work to resolve it with that case manager first, loop in their direct supervisor. If they don't want to work with that case manager, we ask, is there somebody else on their team? Try to keep it in the agency. If that is not satisfactory, then we'll say, okay, which other agency has capacity, and try to offer them choice. But always at the end of the day, we want them to feel supported, like it's a good fit, that they have the good communication that they need. So we'll do whatever needs to be done following that chain.
On page 7, it talks about a 191-page waiver amendment document. Can you talk to me a little bit about that and how you, because that doesn't come from anywhere, right? Trying to interpret and understand that. So how does that impact outcomes potentially?
I think that's to be determined. So a 191-page waiver amendment, this is a document that DHS created. So all of the work that we do, it requires both state and federal approval. So a lot of changes the state of Minnesota approved in the last legislative session. Many of those also need approval by CMS before they can be implemented. So all we know is there's a 191-page document. I've skimmed it. And until CMS says yes or no to bits and pieces, we won't know what is going to be implemented and how that will impact outcomes. Anytime something is approved by CMS, there's still a wait. We have to wait for DHS then to draft the policy, the forms, if there are forms that go along with it, and we're waiting for their guidance and instruction before we can actually implement it.
Brittany, who's CMS?
The Center for Medicaid Services, so that's the federal arm that governs this part of our work.
I'm struck by how confusing the system must be for people who need it, for the providers, for the county. Just the amount of time and energy kind of trying to navigate all of this and noting that that doesn't come from nowhere, that takes real time and wanting to follow the rules as they're stated, so.
Well, you're not asking a question, but I would like to add a piece there. You're hearing from really dedicated and experienced people that have been working in this work for quite a while. But I can say right now, anecdotally, this is the most stressful period of time that I've experienced in this kind of work. The changes are endless. Day to day, we're hearing something else is new and different. It's very hard to train staff to keep up on all that, especially when they're new. They've never worked in all these waiver programs before. And then you talk about the consumer, or people that need the help. It's very confusing, and so they're calling the county or the case manager for help to answer these questions, and we might oftentimes we're trying to figure it out right along with them. So it is a very stressful time, even if it doesn't look like that by how we are presenting today. It's stressful.
Thank you all for all that you do.
Mm-hmm. That leads me into the next question that I have. I'm not going to put words in your mouth, but through the narrative here, I hear a lot of things of unclear direction and conflicting information, a lot of it coming from confusion from DHS and interpretation of how things are supposed to go. I don't want to use the term unreliable partner, but maybe inconsistent partnership. It would be an accurate way to say that. So looking at pages 8 and 9 and the work groups that are currently, are they being built or are they launched already? Are these DHS led or are these coming from the counties with DHS participation? I'm just kind of curious because you've got several here, the MnChoices Efficiency Work Group, the Reimagine Expert Panel, which I'm very curious about, and others.
Yeah, I can speak for the MnChoices Efficiency Work Group. So I've had the opportunity to participate in that work group this past year. We have not met now. I believe the last time we met was June. We're kind of at a pause, I would say. We may reconvene for one more session, but we may not if it's not needed. That work group was really focused on going into our last legislative session on brainstorming and coming together. There was DHS representatives, and then several county lead agency representatives where it was great. It was awesome to be part of discussion of change and brainstorming on what are feedback that we have that we can share of like hands-on doing the work, efficiencies that our teams have shared or ideas of could we try this, could we do this? Many of these things were brought forward in the legislative session, but from my understanding, things were not passed by CMS either. So it's kind of a bummer, but it's still great to see that things were brought forward. In trying to find efficiencies, knowing that assessments do take an extended amount of time, which passes over to case management for a support plan, which takes an extended amount of time. How can we build efficiencies to make this work not more efficient for us, but also the people that we're working with? Like they're having to retell their stories. They're having to do a lot of the things repetitively. So I think hopefully we can continue to find ways to build in efficiencies. So.
Quick question, I think I just missed it. Who's the convener of that work group?
It was through MAXA.
Okay.
I know it stemmed with MAXA, but I'm not sure how that evolved. So I apologize. I don't know that detail to it.
No worries.
Mr. Chair,
Brecken, yeah.
yeah, thank you. Katie, I have way too much to say on this, and I'll try and keep it down. But I want to thank you for being on that work group and just provide some context to anybody who's listening. You know, your group did such good work about the people in the group who work with this directly, coming up with ideas, and then having to narrow it to things you agreed on. Mm-hmm. Then worked with the legislature, who didn't agree with many of those things, just different interests out there, and obviously all the people who receive these services advocate for additional services too. The legislature did come down to pass some what I consider smallish changes that would have led to efficiency. So they did do their work to some degree. And that's the recent ruling we just got from the feds, from CMS, to say they don't approve those changes. So it just shows, I think, how everybody worked hard to find some agreement, then work with the legislature to see what they would agree to. And again, they did agree to something, at least, and it would have helped. And then we get to the federal, and they're like, no. And there's all kinds of political reasons for that. So that's unfortunate. So thank you for that work, and just wanted to add some more policy context to that.
Yeah, I think to just highlight a little more, it just talks of the layers, how it's like, it's not just one decision, it goes through multiple layers. And that's where I think that challenge comes with kind of our DHS partners, how you were explaining it, is like, there's multiple layers that are involved. So it's not easy to navigate when we're part of that puzzle of layers.
Quick follow-up to that, if I might. I think I indicated earlier, this Waiver Reimagine expert panel, I'm very curious about that one. Again, was this something that was convened by DHS or legislative direction, or was this endemic to Minnesota counties, or what?
I can speak to that.
Oh, great.
So I'm on that expert panel.
Oh, good.
And it is a group that I believe was hired by DHS to conduct this expert panel. So the people leading it are not, they don't live in Minnesota. The main person that kind of runs the show, I believe she lives in Georgia. So she's worked with other states as well on their programs and has brought some insight that way as well. But the panel is talking about Waiver Reimagine. So this is set to happen, they're saying January 1st, 2027. And instead of having these four disability waivers, it's going down to 2. And so this is excluding elderly waiver, but our CADI, CAC, BI, and DD. So it will replace that, and it's based on the type of living setting. So this expert panel has really been, we've been meeting monthly since about October. And then people have signed up to be a part of different groups within that panel to do, to kind of, we're doing work groups. The first one was to figure out, instead of having what we call right now a case mix, that determines budgets, it will be called something else. And so figuring out what makes sense and what are all of the different layers of the assessment and how to figure out budgets for people, how's that gonna look? So we've been meeting monthly as well. There's actually another meeting today. And then lead agency staff who are a part of it will be working on, we'll actually be going to DHS for 3 days in either March or April, and using actual case examples, so people who currently receive services. And I think they said we'll be reviewing 300 to 400 different cases to see if all of this new information makes sense and fits and can meet the needs of the people currently receiving services. So it's just doing some extra planning before they launch this new Waiver Reimagine, to see if it will work and to kind of get some input from, there's lead agency staff that attend, there's community members who receive services right now who are attending, so people on the expert panel who are receiving participants. And then some people who are parents of people who receive services. So they've kind of gotten a large variety of people together in this group, but it's all people who have experienced services in one way or the other.
Can I add on to that for a moment? What she's describing, this will reshape the current system. So I think you've heard Waiver Reimagine or that terminology for a few years, but my concern is we're still in the talking phase about how is this going to work or isn't it? And the anticipated implementation date is January 1 of 27. So then you're asking too about the inconsistent guidance and unclear response. I'm very concerned about that. I think case management and MnChoice's supervisors can talk about the unclear guidance that currently exists, and we're going to reshape all of that. and there's been no training and no guidance or policy that we've seen as of yet. So I'm very concerned.
I can understand why. It's a big lift.
If I may, you had asked about the work groups too. The next work group on the list is the long-term services and supports work group. And I just want to call this one out specifically because there's lots of dollars attached to this one. And this one was legislatively, there is a long-term services and supports advisory council that was required by the legislature this past year. As a result, there's been these other work groups that have formed to help inform this work. If you remember, this last session, $177.8 million was being targeted as a cost shift to counties. There's a lot of conversation about that this past year. So this work group is meeting on a very regular basis to brainstorm more ideas for how we can bend that cost curve. If we are not successful in coming up with ideas that save real money for the entire state, Scott County is targeted to receive a cost shift of $810,000 per year and growing. That's with the numbers that we have from DHS right now, which those are subject to change as we move through this work, but this is a real impact, it's real dollars, and so I just want to raise that. I do anticipate we're going to hear a lot about this work and these brainstormed ideas and solutions in this next legislative session. So I just want to flag that for you. And as you heard Commissioner Weckman-Brecky talk about, it's very layered. We come up with all of these ideas, some of them pass at the legislative session, but then they go to CMS and they don't pass. So we've set the bar high for generating ideas that will save $600 million because we know they won't all pass, and our target is 177.8. So we're hoping some of them are accepted in this legislative session.
With respect to time, do we have any final burning questions from the co-facilitators? Okay.
I just have one burning question, and just a simple explanation is just, I'm just curious about this. Why did Scott County move to its own, out of the pool and into its own?
Money.
No. Okay, no, that was the answer I was looking for.
Well, I want to add a little more. So this is about more than just MnChoice's work, but we're highlighting it for MnChoice's work. In the last couple of years, we've been operating at a deficit in that area. We've shifted staff with the understanding that the more work we do there, the more revenue that we would receive for the work we're doing. That has not been the case. We've been tied to the statewide pool for reimbursement, and it did not correlate with the staffing that we've put into the MnChoice's work. So starting January 1, we are in our own pool. So we anticipate that the staffing that we are putting in MnChoice's, we will receive reimbursement directly for that, and it should offset the expense.
Thank you.
Brittany, that kind of ties back to your discussion on the outstate, right? They might not have full-time people doing this all the time when they do the time studies, correct?
Correct. And we're tied in with their work as well, or we were.
Any final comment from the panelists? Anything you want to mention that maybe you forgot to say in an earlier question? Okay, with that.
Katie, no, will you ask them if there could be one thing different a year from now, what each one of them would like to see?
Absolutely.
Start with Melissa.
It's a big one. I'm saying get rid of CFSS. Make it simpler. I would love for that to, they need to, something to more streamline it. I would love to see that.
I think just better written guidance from DHS. I think we are trying to rein in spending and make sure we're authorizing services appropriately, and we have to refer to the CBSM to do so. And that is so vague and so contradictory and times that we're kind of left saying yes to things that maybe we wish we could say no to. And so I think just we need better written guidance for the services that we're authorizing.
I think I would continue to say efficiency is. I think across MnChoice's team, that's something that we continue to focus on internally is how can we support our team with consistency, but efficiency is of finding ways. We do great work, but how can we continue to meet the guidance and do it in an efficient way? So I think as we have done time studies and things like that, I think that's kind of what we continue to focus on. So I'm just gonna say efficiencies.
And mine is kind of tied to that, but I would say less reassessments being done. So that's kind of, I think that would trickle down into a lot of different things. If we didn't have to do a reassessment every year for every person, that would help with our staffing in lots of different areas. So
I agree with Megan. The guidance from DHS, specifically in the CBSM that we reference all of our decisions on, is extremely vague. We often see one county we work with have a different perspective on something versus another county. So it is up to interpretation. We're approving things in one county that another county is not. And then that just makes it more difficult for case managers to kind of feel confident in what they're doing, and then for clients as well. They may be used to receiving something prior to like moving to a different county, and all of a sudden it's not going to be approvable anymore. So clarification from DHS.
I would probably piggyback on that, and also CFSS has been a huge problem, which kind of also leads to the communication and guidance from the state, just more understanding of why things are done. So like they wanted to make this change and they said that it's for the clients, but like there's no evidence of how it's helping the clients. Like it's just made the whole system more complicated. So having that guidance and kind of transparency behind why some of those decisions are helpful. I find that when I meet with clients and they don't understand something, if I do know some background knowledge and can share that, like this decision because of that, then that opens up like, okay, well, I understand that. A lot of times we get guidance that there is no transparency in, and that just makes it really, really hard to be good at our jobs.
And I would say a year from now, I hope things are simpler. I think that would help with everything that you've just heard. Simpler for staff, but simpler for the people that need these services.
Well, thank you all, and I'll turn it back to Mr. Chair for any further questions.
Thank you. Comments or questions from other commissioners?
Thank you. I know Jody has a bunch too. I just wanted to give some context to anybody following along. You know, we saw early in the slides that, 8.1% of our population are using these services, and that's been increasing. But remembering also that we're lower, much lower than the statewide. So this is a huge issue for the whole state of Minnesota. And 8.1%, that's over 12,000 people in the county. So it's a big deal. But why do we care about this so much? Why am I going to, like you'll hear my report, 6 meetings every 2 weeks? Brittany's doing such a great job, going to probably way more than me, is because it's a huge part of our levy and our budget. I just asked Danny for a little bit of information quickly, and this is about aging and disability services in whole, and it encompasses several different areas. But if we look at our budget, we're looking at upwards of $18 million. Levy probably $6 million or something like that. Did I get that right? $6 million. But that's why it's worth putting all this time in. 12,000 people who need help, and we want to make sure they're cared for, but also a significant portion of our budget and our levy. But it shows how much of that, yes, our levy's impacted, but it's a lot of dollars going through, even more so. And that doesn't include any of the dollars are being paid straight to providers. So I just want us to have that context, and anybody watching to have that context. I know Jody will follow up more on this too, or Commissioner Brennan. The one question I would ask, since we have Allison and Elizabeth here, I'd love your perspective. Scott County, and we have approved this, the use of contracted case managers. We've really developed that over the years for all kinds of good reasons, to give people additional choice, to make sure we can ebb and flow a little easier, because we think about when we have a county employee, there's a lot of costs associated with that too. And I think it's been good. I think we've been finding a good balance of that. But we do know there are a couple legislators from both sides of the aisle in the Minnesota legislature who are not big fans of counties using contracted case managers. I'd love to hear from your perspectives if your organizations, we're doing education and work on that, but do you know about Mora and Pinnacle, what kind of work or things that are going on in that arena to influence those folks who don't think we should use contracted case managers?
I personally don't know what Mora is doing. I do know that our contracts are all growing at Mora, so we haven't seen the impact of that yet. Curious to follow up with our director, though.
Yeah. I'm not sure what Pinnacle is doing either. What I do know is I have one case manager on my team who this concern comes up like multiple times a year. They're very concerned that all of a sudden we're gonna have how many people pulled out of jobs, and then where does that leave clients? I don't think counties or really anyone would have the capacity to quickly hire so many people and bring them like through onboarding training to prepare to take on that many clients if that were to happen.
Yeah, thanks for that. And in retrospect, probably not fair. You're doing the on-the-ground work and not doing this public policy work. But we are concerned about it too, and I think we need to all work together on that because I think those legislators are being influenced by one or two people and not understanding the whole picture. So I do think it's a place where counties and your organizations really should be bonding together to show the good work that is being done. So thank you for all you do.
Can I just chime in real quick?
Yeah,
I think there's a
thanks,
lot of
Megan.
benefit. I think sometimes contracted offers better perspective even to internal case managers. I mean, we kind of stay in our lane, we know what we know, but they're working with multiple counties. And so in terms of consistency and how other counties are implementing things, I think it's really helpful. So I think we get a lot out of our contracted partners in terms of, authorizing services, consistently.
Yeah, thank you for that. I agree, and I hope we can tell that story. Thank you. Thanks for all you do.
Go ahead.
Thank you. I sit here as a county commissioner, but also I am here as a mother who goes through this process every year. So every year I have to meet with the courts to talk about the fact that my daughter needs services. So they are aware that she needs services. I also meet with the federal SSI to make sure that she receives SSI, and we talk about why she needs services and what her needs are. I also meet twice a year with my case manager, who I love, and I appreciate all the work that she does. We meet twice a year, and we talk about my daughter and the services that she needs and why she needs them. We also meet once a year with MnChoices, and we talk about the services that my daughter needs and why she needs them. So I'm meeting several times every year to talk about my daughter whose services and needs don't consistently change. And I know she's an individual and she's not the same as the person next to her, but there's got to be, like Melissa said, there's got to be an easier way to do this. I mean, you're spending so much time collecting the same information on my daughter that the next person is collecting. So there's got to be an easier way, and I'm just going to say that right out loud, so whoever is listening out there knows that this is just crazy. But I appreciate everything that you're doing, and I also realize that the senior numbers are going to be increasing over the next X number of years as the baby boomers are going through, and so that's just going to be adding on to the services and the time that you're spending to get those working with those people. So hopefully that's something that's resolved quickly in the next few years, but it sure doesn't sound like it's going to be very quick. So thank you very much for your time.
Thank you very much. And these are in no particular order, but Brittany, you talked about how the system just seems to be crazier than ever. And you've been doing this a long time. How many years, can I ask?
18 or so.
18 years. And Barb Dahl, who's not in the room, I've heard her talk about, she's been doing this a long time. And these times, I don't know what the right word is, just unprecedented, maybe? And you both are probably used to wading through government gobbledygook, that's the technical term. And now here we are at really unprecedented times. On page 2, I think it is, if we can pull that up. Page 1 is kind of the background, who's gonna be on the panel, so page 2 is sort of the start of like this situation or this presentation. Number 1 bullet point, unsustainable systems. Like I feel like that is the bumper sticker of the past several years. on multiple departments and divisions and systems, unsustainable. They just are. These systems are, and there's no easy button, right? We wish we all had that easy button. I think we all realize that systems, both software, the infrastructure, and just the workflow process needs to change. And there's nothing easy about that, especially when we're talking about this particular subject. This feels like one of those areas where government should be the absolute backstop. You know, a lot of times we would like to get involved when the ball goes foul at spring training, so I'll use some baseball analogies. We like to get involved when something goes afoul. Well, maybe let people try to work it out. But in this situation, like, we are the backstop, the collective we. And we have unsustainable systems. We have systems that create so much work that the work can't get done. It sounded like everyone has very similar hopes and dreams to Leslie's question of what do we hope to look for or be at in a year. So, again, these are more just comments, but the question is, what do we, collectively we, yes, on the board, session starts today, I'm optimistic, I know that sounds weird, I'm optimistic, but what do we need, and we're working like crazy, so we have a lot of things going on, we have a lot of efforts into these areas, but based on what we're talking about today and your hopes and dreams for a year out, what do we need to be aware of? What does the collective we need to be aware of? So that when we're talking, texting, and pounding on doors and dragging off of floors and having spirited conversations, shall we say, with our folks in St. Paul, to make real change. Our doors are always open to that, and we are already working on a lot of those things, so, but they are ever changing. I think you just mentioned earlier that things are always changing. So keeping us in the loop, so that when we're down knocking on doors and making our collective voices known that we're aware of that. So we're not just, again, kicking it down the road. The next delivers what matters in a year, and oh, what are our hopes and dreams? And it's another year. It's like, oh, different faces, different places, but the same old crap. Again, I'm optimistic, so whatever we can do to move those along, like I'm in and I'm optimistic. So that's more rhetorical, but you have my phone number.
Can I respond to
Yes,
the
please,
question?
please.
The terminology in the written narrative is unsustainable, but that's not a Scott County imagined word. That's the word DHS is using.
Love it.
So just know that that's something that's understood in today's time. You're asking about, like, what can you do to help? I think it is very hard to think too long-term when what's the highest priority right in front of our face is, to me, my opinion, the cost shift that we need to take care of or prevent. And so anything you can do to help support the brainstorming, the solutions, anything we do to bend that cost curve is gonna make someone unhappy. We're talking about, we can't keep going at this same pace because it's not sustainable. So if we cut back on any one thing, people aren't gonna be happy. So please know that you may be getting phone calls, I may be getting phone calls, but we are not gonna make change. We're not gonna change this unsustainable system unless we start tweaking some things.
Right, yeah, exactly, I appreciate that, and that's an absolute for sure. I mean, nothing changes without some level of pain, but the reality is it needs to change so that there is less pain and more work being done. You know, the hands and feet are actually unencumbered and out doing the work. Last question on this topic is, it's sort of the new four-letter word, you know, you hate to hear it, it's a five-letter word, fraud. And it sounds a little weird, possibly in this particular area, but I think we need to be aware and alert because things have been, wow, really taken advantage of. So what areas, what guards do we have up? Because systems aren't working, you know, the software systems, the workflow systems to trigger some of these things, which I think would work, which is a much longer solution, but something we're after. But in the here and the now, what are we doing? What is Scott County doing with our providers, keeping our guards up to make some gap, even in this like super fragile, potentially fragile group, is not exploited and taken advantage of, because we're sick and tired of it. And there's so much more good that can be done. The state doesn't have a money issue. Yes, we have a structural imbalance, but the amount of money that's been leaking out to fraud, if we had that back in our collective state pockets, We could be doing all kinds of work for the blue and the red team. They could have their own hobby horses. There's enough money if we are better stewards of it. So with this area, what are we doing to ensure that that's happening? The taxpayer dollars are being stewarded and people are being served.
If I could just explain what our current structure is, and then I might ask you guys to add on to it, but fraud does fit in this conversation. It is something that we're hearing about on a daily basis. I want to, just for context purposes, the waiver programs at Scott County, we serve around 2,200 people or so on any year. And I believe last numbers were 14 of those 2,200 clients we serve are being impacted by providers of fraud. So it is a concern, but as of right now, the numbers are fairly small. Scott County's role, our contracted partners, what our role in that is to understand policy, that's confusing, authorize it in that support plan, which takes a lot of time, and then the provider is responsible for providing that service as we've outlined in the support plan and bill for it as it's been designed. The state's role in that is to enroll those providers, write the policy that we can interpret easily, and do the work that we're doing. So there's lots of layers to it, and our role in that is to authorize the service. But anything more that you'd want to say about fraud and what our role is? Because I know that there's a lot of internal work that's being done to look at those high-use services.
Yeah, I think we have a number of committees that meet for some of those more expensive services, just with a number of supervisors to see, does this person really need this service? Is there a more cost-effective service that could meet the same need? So we're coming together regularly to discuss those services, including for contracted. I think the catch is we still don't have the written guidance to maybe make the decision we'd want to make. So when I mentioned earlier, people come to us asking for night supervision, and I think there's a group of supervisors saying this doesn't really feel like the best service to meet the need. This is expensive. But then when we read the CBSM and statute, we don't have anything in writing to back that up other than like common sense or professional judgment. And then when we deny that, then we end up in an appeal. And then that takes hours to prepare for an appeal and attend an appeal and try to justify our reasoning. So I think we're doing as much as we can, but it's still hard when we don't have things kind of backing up our professional judgment, so.
Follow up to that, if I may. With the appeals, how often do we, maybe just anecdotal, but when things go to appeal, how often do we, I don't want to say come out on top, but prevail on the appeal?
I don't know if we have stats behind it. It feels like more often than not, we're upheld. Yes. I think a vast majority of the time, but there are times when we've been overturned.
Sure.
I'll just add that there is like provider fraud hotlines, and at contracted agencies, we just encourage our case managers when they do have questions about providers, or if a client brings up something that seems not quite right, to kind of trust your gut with that and to make that phone call or fill out that website submission to like have them looked into. And that's really all that we can do like from our end, is just kind of make that initial contact of, this may need to be looked at further. And we all talk internally as well. So if we have a provider that doesn't feel great, then we try not to use that provider. But sometimes staffing is really hard to find, and especially in Scott County, not all areas of Scott County are easy to find staff to work with people. So yeah, just encouraging our case managers to trust their gut and lean into that.
Even in Minnesota nice country, like if we feel something like, ooh, do I say something? That's good, because a lot of times people don't want to have those hard conversations.
It is. It's really hard.
Mm-hmm. But it's important to have, because we can't, we got to stop this. Thank you.
One follow-up. Thank you, Mr. Chair. I appreciate that your question was, what are we doing and how are we stopping the fraud? But I think so much of this presentation today had to do with the unintended consequences of that fraud mitigation on the larger level. And just if you all can keep us up to date on that, because we're going to get calls as services. There could be small providers who go away, good providers, but like you said, they're going to go away. And we are going to have to at least look at those gaps that are happening because of that fraud mitigate. There's unintended bad externalities because of addressing the fraud. Like, that's not saying, of course, we should address it, But as it gets addressed, there's gonna be consequences that impact our 12,000 people. And the more we can hear about that and be able to explain that to folks, that will help to just back you guys up too. Thank you.
Thank you. Go ahead.
I don't know. Had several things going through my brain. A lot of it was what Barb just alluded to, and the fact that it's the vulnerable people in Scott County that are going to be affected. It's not the. It just bothers me that I can fight for $50 a year, and people are walking out with millions of dollars. It's just and it's taking away money from the most vulnerable people. So I don't know where I was going with that. It was just on my mind, so I thought.
It's real.
Thank you.
Mr. Chairman?
Yep.
Brittany, will you explain, so just to clarify, when we're saying that we want to do the reassessments every 3 years or something, that is different than the financial check or those types of things, right? Will you clarify? Because that is one of the things we've heard. How could you do that? There'll be fraud. But those are two separate checks, correct?
Correct, yep. So the MnChoices assessment is one thing, case management support plan, that's a separate thing. So what we've been discussing is on the MnChoices side, the assessment side, assessing for eligibility and changes of condition, that we could reduce those to every 3 years potentially. That's something we've been talking about. If that was successful, the case manager would still be meeting with the person at least twice a year, would still have to write a service authorization plan, the support plan every year. So that still continues. So the service and monitoring the provider, that still continues even if we're doing an assessment less frequently.
Mr. Chair, follow up to Leslie's comment, what I've been told, and this isn't always programs that go through the county, but unfortunately, some of the fraud has occurred in people fraudulently claiming services they need that they don't, like the high level pregnancy needs through one program. So that's why we're getting such pushback from the federal level, especially because there are some fraud situations where it isn't a financial thing. It is somebody not really needing the service, the actual disability or thing. So that's what's making our quest to help people at least not have one of those meetings every year and save a lot of money, unnecessary money. That's hurting us too, and that's a hard one to, we kind of got over this hump, like, okay, if they have money, they're not going to qualify, or if they don't qualify financially, but it's because some of the fraud is occurring because of disability service, whatever people are saying, and not really in programs that we manage. So that's what's tough.
All right. Well, thank you for this presentation. Thank you for your work, and thank you for your efforts to better serve our clients that have real needs. And I also am very thankful for our commissioners that have taken a deep dive into these topics. If you arrive early, really early, like an hour or more before a meeting, you'll often see a couple of our commissioners, Brecken and Brennan, receiving briefings together in their office. And I know you've spent a tremendous amount of time on that, so thank you for taking a deep dive on these. And your kind of mandate, man, that's a deep dive where you're going. I created a cape and everything for him. Anyhow, but with AI and not real, but thank you. Yeah. We're on to 7.1, which is Resolution 2026-43, authorizing submittal of comments on the Metropolitan Council's draft 2026 regional solicitation and application processes.
Morning.
Morning.
Craig Jensen, Transportation Planner. I'm here to talk about the regional solicitation comments, but first I will give the background and Brad Davis will provide the actual comments that are planned to be submitted. So the regional solicitation is something that is out every 2 years. It's the federal funds that are distributed to the regional planning organizations. And the last session is 2024, where over $264 million was distributed to 59 projects. In addition, there was $19 million in active transportation state funds that was distributed to projects that had submitted for the regional solicitation. And that was really to do a trial basis for the Met Council for their kind of internal grant organization. So Met Council updated the TPP in early 2025 through a process that was done through 23 and 24. And it was expected that with this transportation policy plan update that the regional solicitation would be updated as well. The last time this was updated was in 2014, which had brought some significant changes in how it was laid out before. So prior to 2014, regional solicitation was split up by the functional class. So roads that were in the more urbanized areas competed against each other, roads in suburbs competed against each other, and roads in the rural areas competed against each other, which seemed to kind of provide some more regional equity to how things were split up. In 2014, it went to more of a mode organization, which was kind of roads. They compete against each other throughout the region, trails and transit. So,
Craig, what's an MPO? Will you explain what that is and like how many do we have in the state?
well, the Metropolitan Planning Organization is what the Met Council is, and they are responsible for receiving the federal funds and distributing it. There are many MPOs throughout the state, but they're the larger ones, which are like Mankato, St. Cloud, and Duluth area. So they are responsible for receiving the federal funds. They also, and distributing it, they also have kind of a lot of leeway in how they actually distribute it. They have to provide, follow certain rules for it, but when they distribute it, or at least the Met Council, when they were looking at the regional solicitation, they also kind of did some peer review as well. So the Met Council really didn't look at other ones in the state. They looked at ones that are similar size throughout the United States to see how they were distributing funds as well. So Met Council does it a little unique out there, and through this competitive process. So the funding, so the regional solicitation was split up through a group work into basically the goals of the transportation policy plan, and that's how they shaped their categories here. They had 5 main goals out of the transportation policy plan, and you see 3 at the top here that are kind of how they lay out the solicitation. 1 is safety. They brought safety forward. So typically the HSIP, which is the Highway Safety Improvement Program, which was a program through that MnDOT ran. These are small projects, less than $2 million is that funding. But through this process, they're calling this large projects, up to $7 million, is being brought forward for competitive regional solicitation here, where with this competitive regional solicitation, they're really looking to fund the most critical, those top 25 crash areas throughout the metro is really their focus with that category. The other goal was for the region to be dynamic and resilient through the transportation policy plan. Here they have it under 3 different modes. You have your bike ped mode, which has your regional bike facilities like the Miriam Junction Trail. And then they also have their active transportation funding, where they're going to fund the smaller, more local roadways. So there's the transit mode, and then there's also roadway, which gets into your roadway modernization. Congestion management strategies is that old expansion category, and that's really, they're looking at those most congested areas of the metro. New interchanges is kind of a category where they're looking to replace those at-grade intersections into interchanges. And there are about a half dozen identified throughout the region that they're really trying to focus those funding for. And then they have a category called environment, which was really two goals from the transportation policy plan. One was natural resources and the other one was climate change. They put under environment. And then the last goal is not its own area, which was their equity goal for the region. And they are actually spreading that across all of the projects or all the applications into a category called community considerations. So where we're at is that through the process, there was these draft documents provided and released for public comment last month. The application is anticipated to go out in the spring with a spring to summer deadline. After that, they will be scored through some scoring committees. And then in late 26, usually about December of this year, there will be the selection, the final selection of the projects. And that gets into, I think, some of our comments.
Thanks, Craig. Brad Davis, Director of Physical Development. So Craig is probably one of 3 or 4 staff that have been tracking this regional solicitation process through their participation in some of the technical advisory committees. And of course, Commissioner Ulrich, as a member of TAB, or the Transportation Advisory Board, has been very closely watching this process, and I think has shaped some of the comments that you've seen in the comment letter. It's this community considerations. This is one of about 8 criteria that will be used to score different applications for the different types of projects that Craig outlined. This is the scoring criteria that probably got the most attention over the last 6 months from technical staff and TAB, really debating kind of the merits of this and the weight of this criteria. This is the one that I think we've focused on the most in the board's comment letter. It is tied back to the transportation policy plan, as Craig said, and specifically around the goals of equity and environmental justice. So that's kind of the framework that is then being scored under this community considerations. And this is a slide from one of the Metropolitan Council presentations, and I'll just draw your attention to the italic language at the bottom of the slide. Community considerations ensures the needs of specific populations are considered and prioritized in transportation decisions. This struck us at a staff level because, as Craig explained it, this is really meant to be looking at making investments across the region and what's kind of best for the common good of the region, and not necessarily for specific populations. And so I think that's kind of the theme you start seeing in our comment letter. So just a comment on the scoring criteria. So this was pretty heavily debated throughout the last several meetings at TAB, just how much weight does community considerations have compared to the other criteria. And so this is a graph that shows that, and for roadway categories, it's showing up as a 20% of the points that applications will get will be scored on this community considerations. I think the debates that I heard is in some areas that's equal to safety, and again, are we adding more weight to these community considerations or equity and environmental justice versus points for a safety criteria related to a project? And that's a lot of the debate. At the end of the day, it did land at 20% for most of the applications. The only change that came at the end is if someone was applying for a safety project in the safety category, community considerations was dropped down to, I believe, 15%.
Just if I can make one little fine point here, you know, the different categories, that is what is going to be done. This community considerations is how you're going to do it. Did you engage your community in a certain way? Did you get feedback? Did this arise from community needs? It's a how. So that was why we so strongly debated it is, look, 20 points for on how, but not what, not what you're gonna, but just how you went about it. I mean, it seemed incorrect to be thinking that way. At least get, everybody was willing to have some community considerations. I think the region, many were trying to push that as a 10% across the board. It's 20, and then even in the safety category, it's 15% of the points. So, okay, that was my fine point there.
Yep, thank you, Mr. Chair. Yeah, so when it comes to the county board's comment letter, again, those are due today, so we'll be prepared to submit those comments later today if it gets approved here. Really focuses on some concerns around community considerations. I think one thing that caught Commissioner Ulrich's eye early on is it defines community as a certain type of user of the system. It does not include motorists, commuters, freight haulers, people who only travel through the project that's being requested for improvements. So we call it that pass-through community is not going to be considered part of your community engagement. We think this, excluding this input from that segment of the population is really a disadvantage to developing suburban areas such as us here in Scott County, where we have a lot of needs and investments for our regional system that may not be in a location that you have immediate neighborhoods around that either interchange or intersection or roadway. We have a lot of people that travel our system that are passing through or going from point to point. We think that's critical for mobility and it's good for the regional system. And if we can't engage that population, that's just going to work against us for any projects that we apply for. So we're really asking for the Met Council to reconsider how they're defining community and not ignoring what we think are just as important, the regional users of our system, not just the people that live immediately adjacent or around a project area.
I want to make another point here. Consider how we have used our transportation sales tax. Unlike a lot of counties, we have used it on the major systems, in MnDOT's, a lot of it's been on MnDOT's system, and so we're trying to make mobility and safety on these major roadways, and we're investing our money. Other counties have done a more local approach, and no, MnDOT, you do your own thing. We're going to do our local stuff with our transportation sales tax. We've taken the more regional, and then imagine that with this, we can't count the people that we've decided to help with our transportation sales tax.
I know Commissioner Ulrich, you've pointed out a project such as the Highway 13 corridor, which we get a lot of freight users and truckers that really benefit our agricultural community and a lot of our businesses. These are folks that really, really value the investments made on that corridor. Obviously, they don't live in that corridor, they're passing through. So this criteria would tell us we could not engage or get surveys or feedback from that type of population as part of our application.
Yeah, I think that one is really concerning, Brad, because the freight study and the freight work was a huge impact on the funding for Trunk Highway 13. It's a major port for the entire state. And when you look at the system that the Met Council through the MPO, as the MPO is supposed to be funding with these dollars, they're regional roadways. They're not funding small city commuter streets. They're looking at A minor arterials, principal arterials, and those are the types of roads that are based a lot on through traffic, carrying freight, and a bigger part of our system. So that is a real concerning one.
If I could step back and take one global stab at this. Equity, okay, equity. We have, over the years that I've been on the tab, that's 25 years, tried to make sure that the money that the region received was equitably distributed to all the different counties, all the different regions. So Hennepin, you got your shares, Ramsey, you got yours, and so forth. Scott, we got our fair share equitably, the money, okay? If something that wasn't equitable happened in our county with that money received, that's on us. Likewise, if it happened in Hennepin or Ramsey or elsewhere, and there's complaints about how that money was used, that's on you, So it's all of a sudden to come back with this big equity issue I don't believe we've had people say to us in Scott County, you didn't equitably use the money you received. I don't ever hear, I've never heard somebody say that to us in Scott County. So that's really troubling that, but I would also say, if you want me to give you examples in your county where it wasn't equitably spent, I will. Like, for example, the Hiawatha Light Rail line that you built, you know, and you bragged about all these coffee shops, these French coffee shops above and all these buildings that were along that corridor. What a great thing that was. What happened to the people that lived there? You gentrified the whole corridor. Where did they go? Did you even care about that? Did you have any solution to that? It seems inequitable to me. We don't have that kind of thing you could point to in Scott County. Okay, that's my end of my tirade there.
So in another area that we expressed some concerns in the board's letter is this notion of harms, and it appears that applications will be rewarded if they can demonstrate that historical harms caused by the transportation system will be mitigated. And I think we strongly oppose rewarding points based on this, what we think is very subjective analysis of perceived historic harms. And again, based on how they define community, we assume that analysis of harms is really just coming from that highly localized, location-specific input. Furthermore, we question whether basing it on this historic harms and some of the socioeconomic data that will be used to presumably build that argument is even consistent with current federal funding policy. And so in the letter, we asked that the USDOT and the Federal Highway, what is the WA?
Federal Highway Administration?
Federal Highway Administration to advise the region if this is even consistent with federal policy.
So Brad is spot on. Out of the Transportation Committee, Commissioner Ulrich and Commissioner Brennan asked us to reach out to Ron, the county attorney, and Jeannie. We did have a discussion with Jeannie, and she advised that before we take other potential action, that we request as part of our comment letter for USDOT and FHWA to weigh in, that with current transportation policy, is this consistent with that? And that they do ask for an opinion from those agencies on this.
Finally, just the last couple bullets, again, talking about just the weight of the community considerations. Again, questioning why it's 20% across most of the categories. It seems to outweigh some other core technical objectives when people are scoring these applications. And just commenting on that, again, the counties, Scott County took a position early on that we thought this should be worth 10%, or maybe in some cases 15%, but not 20%. And then the only last bullet there is not so much related to community considerations, it's just the active transportation bucket. It's been a concern with a lot of suburban counties that there's no cap on the number of applications that a community can submit for that. And without a cap, we're concerned that some of our larger agencies in the region could kind of flood the application pool. And so at a staff level up through TAB, we were recommending a cap of no more than 2 applications per agency. Again, we're ready to submit the comment letter later today based on your action, and I'll stand for any questions.
Okay, I've got one. When you say active transportation, I noticed you had active transportation planning in the regional solicitation, but there's a active transportation pool of like $23 million every year that's state money. Is your active transportation comment on both then, or what?
What we envision is for the projects, yes, there's anticipated to be $50 million for the active transportation.
That's because there's pooled 2 years worth of.
Yep, correct. And so we feel that there are larger, as through the active transportation, they had this goal of trying to spread it out, have these go to smaller communities if possible, so that they can compete with this, because they cannot sometimes compete against Minneapolis, St. Paul, and those larger communities that have larger resources. So the thought was, well, those ones with larger resources have larger resources to put in more applications then. And so they're gonna potentially push out some of those smaller communities that could apply. And so our feeling was that, and this kind of did not move forward, but this was brought forward through the committee process, that we thought they should be limiting the number. I think there were some people uncomfortable with limiting the number and just see how it goes through the process and see how many people actually apply for this funding. But we felt that these large communities can really, dominate the region with a number of applications.
One other question, and I'm sorry to monopolize this, and I'll pass it on to you guys in a second. It did seem to me in these planning groups that the technical folks, from the counties, were like a late add. Did you feel that way? Like, why weren't we engaged early in the process? Did that occur? Did you feel that way or not?
My own personal feeling was that it was fairly rushed, because they got going. They had this spring or summer, some committees where we had discussions and talked about topics, but we really didn't see the applications till this late summer, fall, or at least those kind of not the buckets, but the kind of the details behind what they were looking at here. So Met Council had a consultant that was helping them, but I was on the bike committee. We only met the 2 times early in the spring and didn't meet again. So we didn't get some of the detail behind it.
Well, my perspective is that those committees were met for at least a year, and you're just talking about, that seems to me sort of late for you to be engaged.
Again, it was, you're talking at the high level information, you're trying to get the buckets formed, you're trying to think through it. But until we actually saw these applications, we didn't have a lot to debate and talk about.
All right.
Yeah.
Okay, other comments or questions? Yep.
Thank you. It's Met Council stuff, right? That's the stuff we are used to sort of having to wade through. Didn't we, when this first came out and that whole harms theme was kind of front and center, we put in some comments, and it was sort of oh, that's adorable. We're at the adult table, we'll deal with it, right? Nothing much changed after that. And so here we are commenting again, which I guess the part that is, I don't know if infuriating is the right word, but so annoying. I feel like our mentality in our cute little adorable Scott County, just about in everything we do, is so regionally focused and beyond ourselves and our own little corner of heaven here, that we just get lumped into this, oh, you're out to hurt people, you're nasty, you're no good, we know best, just buck up, camper. And I know, this session's gonna be interesting. I don't know where Met Council reform is. It just seems like such a, I don't even know what to say, where to categorize that. But I feel like our body of work speaks for itself. I don't know if the staff at Met Council, I know we see more at scale, and I don't know if they drew short straws to be there, if it was some sort of a sentence that they're coming down, but at least they're making an effort of sorts. And so I don't know what the right answer is to make real reform, but it's just such a crazy process for us. So again, more commentary than actual questions, but are you hearing anything? Perry's in the room, any Met Council reform this session? Or is it just the same old, same old? It's kind of a asterisk down at the bottom. A perennial legislative priority, air quotes.
Commissioner Beer, it sits on the agenda, but if you ask me, this is the year you have a governor that's not running. It should have been potentially a year for discussion, right? But we've never made any ground since that push a couple of years ago. And so Micah, none of the counties have really pushed it as a priority. It sits in scale, it sits in our agenda, but it hasn't been one that has been a priority to lift.
Yeah, and Commissioner Beer, I can't speak necessarily to the Met Council reform, but back to, I think another part of your question is this going to make a difference? Here we are again, we're submitting comments. I feel strongly that it is important for counties to take a position. If we stay silent, I think that speaks volumes. So I think it's important that we are commenting, and I think we're hearing some other counties are also preparing comment letters, maybe not from their board, but from their staff. So I do think it's important to comment on it. And over time, I think messages get delivered.
Yeah, and I know you didn't read that wrong, that yes, of course, we're gonna submit this. And you know, I go back to my, 2 falls ago, I guess, at the AMC policy conference, and, you know, people are sick and tired, you know, different county commissioners, administrators, different staff, sick and tired of being sick and tired, but, you know, what do you do? Now, last fall, 25, you know, there was a little more anecdotal, not, you know, scientific, but a little more like, there were those that were sick and tired of being sick and tired and were falling off the bandwagon, like, there's nothing we can do, but more so being sick and tired of being sick, across the gamut, right? Not just this particular topic. Sick and tired of being sick and tired and ready to double down and do what it takes to get this pushed through. Different types of reforms across the different divisions, and I think we found that with some momentum we had as counties last year, and that's why I'm so optimistic this year. But yes, I am not saying don't comment. I'm actually, you know, saying double down, of course. And hopefully it's good to hear that there are other, so there's some counties that are doing it more at a staff level, so it doesn't come as a board resolution or approved comments. And if so, does a board resolution or approved comment letter carry more weight, potentially? As I would think, but thanks.
Commissioner, members of the board, I believe, I would hope that the hearing from the board carries more weight. This is public comments, so they are accepting different ways to receive public comments. You can go on their website and submit public comments. So we may have, you know, 50 comments from one particular special interest group on the regional solicitation, but I would hope that the county board, speaking for all the citizens of Scott County, carries more weight than that. As for the community considerations, you know, it is not its own category today. I could foresee that, you know, through work that the Met Council does, because it's in their transportation policy plan. They're actually currently working on a highway harms study. And depending on the results of that, I could see them trying to fund projects that are identified, and this is just my own opinion, but I could see that being identifying projects through the highway harm study, and then creating a category in the future for this, community considerations. Now, I don't know what that's gonna look like. Maybe then that would lower the community considerations because they would have its own category now. But I could foresee that happening for particular projects.
Yep. Go ahead.
I would like to make a motion to adopt resolution number 2026-43.
Second.
We have a motion and a second. Any more discussion? All those in favor say aye.
Aye.
Opposed? Motion carries. Thank you. Keep up the good fight. Item 8 is committee reports and commissioner updates. We'll start with Commissioner Brecky.
Thank you, Mr. Chair. Our last meeting was February 3rd. Later that day, I had a mentally ill and dangerous civil commitment reform task force meeting. I know I said that we already had the last meeting, but we haven't because we haven't agreed upon our report yet. We're still working away. There'll be at least one more meeting. February 3rd also had AMC Executive Board. February 4th, Law Library Board meeting. I can't emphasize enough how many folks Ally McNeil is helping in the law library. You know, just so many people of needing legal forms, information, or she just tends to be a person where people come to her and she sends them the right way. So she's just doing really good work there. February 4th was one of the, I'm just going to call it County State Long-Term Services Steering Committee meeting and NACO Human Services and Education Committee meeting. February 5th, we had a Scott County Justice Steering Committee meeting. February 5th also had a long-term services and supports meeting and another one on February 6th. February 9th, we had the Scott County and Scott County Court quarterly meeting. Just good to connect with judges and court administration every quarter, talk about, especially facilities and security and those things. February 10th was my monthly meeting with the county administrator. February 10th was CAP agency board meeting. Obviously, the CAP agency has a lot of the same uncertainty we do as state and federal changes have impacted people who live in the 3 counties, the CAP service area, and they're doing a good job trying to respond to all of those things. February 11th was MICA board meeting. February 12th had another county state long-term services committee meeting. February 12th through 13th, we had the AMC Futures Task Force, and several topics, but we had especially some folks from the Department of Corrections and the State Sheriff's Association talking about jails and regulations, and really our Department of Corrections and our State Sheriff's Association are on some very different pages, so it was good to talk through some of those differences, brainstorm some maybe ways that as county commissioners we can influence some of that, because we know those regulations make a lot of our work in the jail very costly. And there were some suggestions on different and better ways to handle some of that. So that was good, that was positive. February 13th, I virtually attended the Scale monthly meeting, and February 13th had another long-term services and support subcommittee meeting. So those are what I've been doing. 2 things. One, I've in the last 2 weeks received a couple more calls, connections about the new state law that allows rifles for deer hunting unless we opt out to stay a shotgun-only district. I received my first call. I told Leslie earlier it was just one person, but it was 2 people, 2 separate people on the same call. So 2 people who want us to consider the shotgun-only district. Talked to fellow commissioner in LeSueur County, who they're still considering that issue, and he's receiving a lot of folks who want to stay shotgun only. We talked about our joint border there. So just, as a board, we haven't scheduled a public hearing or decided to do anything yet, but I'm just kind of keeping track of the people who call me. Also, Leslie's working with others to really keep track of what our adjoining counties are doing, because that just creates some real issues if during the deer hunting season in an area, as soon as you step over county lines, the rules are different. So I think we want to learn more about what's going on and then, bring it back to a workshop or something. And then finally, obviously the session starts today. I think especially tomorrow and Thursday, there's transportation and bonding committee hearings that, we'll want to start paying attention to what's going on. A lot of bills are going to be introduced, and I assume there'll be lots of opportunities for all of us, but especially Commissioner Beer, to go talk about mandates, or I think it's just really important that we watch these bills for things, and I know Perry and Jake are here, for things that are going to impact counties, because I think of a license plate bill from a couple years ago that, it's a very popular type of license plate, but all those folks getting that license plate, there's less revenue. It's a different revenue share. There's all kinds of really actually good legislation that we might agree to as a person, but we need to make sure we're looking at the county impact. So that's the end of my report, Mr. Chair. Thank you.
Thank you. Commissioner Wolf.
Thank you, Mr. Chair. I just had a couple things. The third was caucus night, well attended, where I went at Twin Oaks Middle School in Prior Lake. And on the 13th scale, I was on virtually, as was Commissioner Brecke. I look at all this, the money that comes and goes, and I sometimes think, why don't we have some, I don't know who decides some of this stuff at the state, but if they would have people that were in the field and maybe could help out a little more and make up, just seems like we'd save money and make things more efficient, other than people who have sat maybe down at the Capitol their entire lives or careers. And that's my report. Thank you.
Thank you. Commissioner Brennan.
Thank you.
February 4th was the Scott County Transportation meeting. February 4th was the Parks Advisory Committee meeting. Parks staff is working with the Nye Nature Center to provide programming and day camp opportunities at Cedar Lake Farm Regional Park. Our customer service area downstairs has parks programming and camper cabins listed on there. So people are a captured audience. They can do a QR code and find more information about programming and the camper cabins. February 5th, I met with Vanessa Strong to discuss the Scott County WMO and the comprehensive plan update. February 9th was the suburban transit meeting. Legislative update centered around funding. After the meeting, the STA sent out a Met Council high subsidy transit report that I forwarded to Leslie Vermillion and staff. February 10th was the Scott County CDA meeting. Trellis will be developing their former site. The goal is a 40-unit workforce housing apartments, which is on for 80% average medium income. Trellis is working on the grant funding through Minnesota Housing, and construction should be complete in 2028. February 11th was the MICA meeting. Representative Don Gilman was president. MICA expressed their concerns about the implementation of the act and the need for updated systems. MICA staff provided a legislative update in various areas. Transportation Committee is considering eliminating the opt-out bus and expanding bus rapid transit. There's a disagreement about the interpretation of statute regarding the allocation of 17% metro area sales tax for transportation purposes. In a nutshell, legislation spells out how counties can use that 17%. And in case any of our legislators are listening, that can be found in Minnesota Statute 174.49 subsection 6. The aquatic invasive species county aid funding will be cut by 50%. Watercraft surcharge fee is increasing starting in 2026, which will provide grants to local governments for AIS prevention efforts. But it's unknown how that's going to actually happen. February 13th, I had our scale meeting, and February 13th, I also had a meeting with Leslie Vermillion. That's all I have.
Thank you. Commissioner Beer.
Thank you very much. February 3rd, monthly administrators meeting. Also attended caucus night. I don't always get to go to those, but finally was able to make one, so that was good. On the 4th, I had Hope's Portage. I'm like, wait, we did the ribbon cutting the week before that, but there was a very quick appointment that was able to be made, tour with the interim HHS director, Serene Gandhi, if I got that right. So it was great to have some of her staff willing to come down and see some of the fruits of their grants and some of the fruits of our, I think, ideas in our hearts of what we want to do to try to bring hope and transformation to people's life, hence Hope's Portage. So I was happy I was able to do that. On the 5th, met with a constituent who's also running I hope to be more of a partner group with us, doing great work, Katie Morris with the Moms Group we always hear about at different times, and just thinking there's got to be more ways for us to partner with her and that group, because a few times they've been in and done presentations. It's just one of those opportunities, feels like, wow, they're really doing great work there, and how can we partner better with them? On the 10th, I think I must have been in Florida, because I was and I'm super grateful for Zoom opportunities for this very reason. I had a fish program meeting, and later asked me, I think poolside, if I remember correctly. But the one thing I wanted to mention about ASME, with the presentations, with what we're talking about here today, with session being started, with what's gone on last year, you know, I've asked the question, hey, what can we stop doing that's not going to hurt somebody with these unfunded mandates, not anti-mandate, anti-unfunded mandate, but yeah. So that should be out of the tailor real soon so that I can don that, so we'll see. But the messaging to our staff was one of the questions that was brought up. How do we best message those conversations with our staff of the word I'm getting is that, you know, they're just being told to do more with less, and I get that, and trying to convey, you know, at least my position on trying to change things so that things are more sustainable, things are more reliable from the state systems and what we're doing here at the county. So I just wanted to bring that up as a topic for the broader board as well. On the 11th, was able to, this was going to be in person. I was bummed to going to be missing this, but they brought it to Zoom, not just for me, thankfully, but for the AMC convened the tribal meeting as well. This is the second time this year. Or wait, no, the first time this year, second time in the last 4 or 5 months. I think the last one was October in Duluth. In this one, I was able to walk down Turtletown Trail with my grandkids while being able to partake in this meeting. So, and yes, men can multitask some of the time anyway. So it was great to be able to zoom into that meeting and continue these ongoing, very important conversations with tribal folks from around the state. So great option. And then the 13th, yes, zooming in once again to scale, I think from the Gulf of America, which was very foggy that day. But I was walking, most of these times I'm with my grandkids. And so paying attention to what's happening and seeing my grandkids, it was just that great reminder of, not that I needed that reminder, but this is why I do this stuff. And I think probably many of us, to make things better for not only this generation, but for the next. And so the topic was mandates. Session is starting, and I'm just gonna, not really a meeting, but today I spent some time just really kind of praying through things, texting with our delegation, those that I have communications with. Some are just one-sided, don't always hear back from them, but everyone I texted this morning texted back, and just wanted to let them know, taking a page out of my encouragement from last fall of praying for, not only by face and by name, not only the people we agree with most of the time, but those we don't agree with. And this system is so broken. I don't have to tell any of us that. It's not sustainable. I think we all know that, and it feels like that maybe this state and St. Paul is starting to feel that. The reality of fraud is so grotesque and acute. It's like I always kind of felt like the state doesn't really have a money issue. It has a stewardship issue. And if we had this money back, both teams could do their hobby horses and be fine, and there'd be plenty of money and less taxes and lower cost of government, but good night. And I know we're pessimistic of sorts, and you hear it from them. Oh, we don't have any money. It's short session, 67-67. What's the Senate? Is it one vote majority? Narrow majority there. Governor who's not running. But I just feel like, I feel so optimistic, and I feel like hopefully we can change the way that we see this session going into it, because we have our priorities. And so it was good to communicate with most of our delegation, not just today, but leading up to it. And I'll be down there quite a bit this session, which I'm actually looking forward to. It goes to show you how optimistic I'm feeling about this with the momentum we made last year and making things better, not only for the people of our county, but for the state. Minnesota, sorry, this is going off a little bit, but it used to be one of those bellwether states that you could point to of good governance and, always high voter turnout, which we still have that, but now it just feels like it's been a total flip-flop of like the Gong Show on steroids. And I feel like the heart that we have as Scott County, we want hope and transformation for the people we serve. And I think our body of work shows that. And the momentum that was gained, I just really hope that we see this session as through an optimistic view. That I'm hoping that the ingredients are there to make real change. Yes, there's no money because we have this structural imbalance, but some of the things that we could change and be better stewards, it might not require money, but might require backbone and making decisions and some courage. So I'm looking forward to that. So with that, I will end my report. Thank you.
You sure?
I think so. Fairly certain.
Okay, thank you. On the 3rd, I attended the precinct caucus night, and it felt weird that my caucus meets way in Dakota County. It's not even in Scott County, which is crazy. 4th, the monthly meeting with Leslie Vermillion, Scott County Transportation Committee meeting. The 9th, the Suburban Transit Association Board meeting, and they're obviously going to be hitting hard the value proposition of transit providers, the opt-out transit providers, because they will be under some kind of questioning. That's probably an understatement. The 10th Fish Programming Committee, they like to be about 6 months ahead with their topics for programming, and that's what they're at. We also agreed that we would program in advance different nonprofits or service groups or whatever that would come and tell about what they do in the community. So we have 2 or 3 of those at each meeting. So we're gonna kind of book those ahead. The 12th, excuse me, the Fish Second Thursday meeting, we're gonna be switching to a lunch and learn format coming up fairly soon, where Fish will not meet from 9:30 to 11, as it has in the past. We'll be meeting 11:30 to 1. And within a few months, we'll be meeting not in the county building. There's some question of whether that's a good place for Fish to meet. Probably not, because some are reluctant to come to the county. So we're gonna be meeting somewhere in Shakopee, but not in a county facility. The last topic for Fish was community support for moms and families. On the 13th scale, they were talking about unfunded mandates. Thought you might just fly in for that one, you know.
Exactly.
MBTA Finance Committee later that same day, and Monday I was in deposition preparation. That's the end of my report. Yeah. All right, so we're on to county administrator update.
Well, we have lots of things going on. So first off, I did want to thank Barb Dahl and Jake for their outstanding job Friday morning. They both did a nice job preparing for scale. To Matt Hilgert, AMC brought a broader perspective than it's just Scott County, right? This is a statewide issue. And then to Dr. Thomas and Dr. Lager as well, because it really brought in the system thinking that we have talked about for years, and how do we reevaluate where we're headed. You know, you heard sitting here on min choices, it's layer on layer and you can't agree. And when you're taxing in DC and delivering it in little old Lockheed Paro and Scott County and places like that, it gets difficult then. And so looking at the federal, state, that county role and how to be more efficient was a really good discussion. Number 2 was the shotgun rifle for deer hunting. We have reached out to LeSueur, Rice, Sibley, and Dakota County just to find out where they're at, because we are kind of sitting between all of those. Carver is having a discussion on March 10th about Carver County, so we'll hear that update. And as soon as we know more, I'll report back to you on that issue. And then third, we did send, Brad and I, a very draft letter to Dakota and Carver's administrators. The one we talked about at our work session with Carver County that we would send to Bowser regarding the Minnesota River and kind of taking a different look from a water quality to an infrastructure impact, and what would that look like, and not putting it all on the shoulders of the lower min. So hopefully we'll hear back from Carver County and some specific comments from Dakota here by the end of the week, so we can continue to move that forward. And then finally, you know, we've been working on the joint children's mental health issues with kids that need to be at the JAF or a secured or a high acuity. And we've been meeting as a metro region on that. Of course, Hennepin has moved forward the high acuity. We have the secured and Anoka that we just entered into a contract with. Dakota has the secured, and we've had the unsecured. So one of the things that has come back, and Hennepin has actually even offered to write some of the legislation, is my understanding, would be to potentially bring forward a bonding request for an update to the JAF, or potentially even a new location for the JAF, maybe over at Southbridge or something like that vicinity. But I'd like to bring back to the chair, vice chair, who kind of acts as our legislative committee, since we don't have one at the next meeting, and potential amendment to our legislative platform that would begin that process of talking about bonding money for the non-secured at the JAF that could be more regional in nature. And so it would then, if the chair, vice chair were wanting to move that forward, we would bring that back to the March meeting then to amend our legislative platform to have that be an ask. I think I'd probably even recommend that going before the MJT at this point, with the obstacles we have in moving the MJT forward on County Highway 14 and some of the funding that we're looking at there. So if I were to see a nod of heads, we'd bring that to the chair, vice chair, some direction to do that. It would probably be even more, not that you're going to get some action, it's pretty late to the game right now, but at least to talk about and get it out there for potentially moving forward in the future. And we have regional support from Hennepin, Dakota, Carver have all given a nod to this, that they would support this moving forward. So kind of came about recently out of those discussions.
Thank you. Well, we've been waiting all morning for item number 10.
Mr. Chair, we do not need to meet.
Okay, thank you. Item 11 is adjourned. We need a motion to adjourn.
Second.
Motion and a second. Any discussion? All those in favor say aye.
Aye.
Opposed? Motion carries. We are adjourned.